The first thing I would do when I come in would be to perform hand hygiene and get his name and date of birth. The next thing I would do would be to unwrap the patient and put him on a table and observe his extremities, which should be flexed. The next thing I would do would be to get the head circumference, so I would use a tape measure around the top of the head and place it and get the correct measurement. It should be between 13 and 14 inches. The next thing I would do would be to lift his arms up and get his chest circumference. And then I would get his length. And I would take him to a weighing table and get his weight. The next thing I would do would be to assess temperature. So I would take a thermometer and get an axillary temp. And it should be between 97.9 and 99 degrees Fahrenheit. I would assess his respirations by observing the rise and fall of his chest. And that should be between 30 and 60 breaths per minute. The next thing I would observe is the apical pulse. So I would place it on the point of maximum impulse and count for 1 full minute, and it should be between 110 and 160. I would also assess the rate and rhythm. The next thing I would do would be to identify the fontanelles on top of the head. So the anterior fontanelle would be at the top and it's diamond shaped, and the posterior fontanelle would be towards the back and it's triangular shaped. I would assess that they're soft, flat, and slightly depressed. The next thing I would assess for is to see if there was any molding from the pregnancy, from the labor and delivery. The next thing I would assess for would be the caput succedaneum and the cephalohematoma. So then I would open his mouth and check his mucous membranes. I would assess that they are intact, pink, and moist. And then I would also assess his palate at the top of his mouth. I would look at his eyes and assess for any drainage or puffiness. I would assess the symmetry of the eyes, and I would assess the position of the eyes in relation to the ears. The next thing I would assess for would be the eyelids and the conjunctiva for any hemorrhage. I would assess the blink reflex, and I would assess positive red light reflex. The next thing I would check would be the nose for patency, since neonates breathe through their nose primarily. The next thing I would check would be the ears in relation to the eyes. I would then check the range of motion of the neck. So I would assess for the tonic reflex. I would bring his neck towards the side and let it go. The next thing I would do would be to assess the nipple locations. They should be on the midclavicular lines of both sides. And then I would listen to his breath sounds. So I will listen to it on the front and back of the baby. I would then assess the heart sounds. The next thing I would do would be to palpate the femoral pulses. And then I would look at the abdomen. I would look at the umbilical cord for 2 arteries and 1 vein. I would assess the clamped cord for any drainage or redness. I would also assess his bowel sounds. So clean my suckers up again. And assess bowel sounds, which are usually hypoactive for the first few days. I would then assess for the genitalia. I would assess for the meatus, which is the tip of the penis. I would assess for the scrotum. I would assess for the testes, and I would look for hydrocele, which is an enlarged scrotum due to excess fluid. The next thing I would check for would be the legs. I would assess that the legs are equal, also with the fat folds in them. The next thing I would do would be to assess the spine. I would pick him up and assess his spine from the back. The next thing I would check would be his buttocks, so I would lay him down on his stomach and expose to make sure the anus is patent. The next thing I would do would be to assess the extremities and the digits. I would assess for the presence of cyanosis in the arms or the legs or anywhere on the body, and I would also assess the foot creases in the baby. The next thing I would do would be to check and see if there was a hip clip, and I would use the Ortolani maneuver and the Barlow maneuver. The next thing I would assess for would be just general skin, so I would assess for jaundice, which is a yellow in color of the skin. I would assess for pallor, which is an unhealthy pale appearance. I would assess for milia, Mongolian spots, and toxicum erythema. Now I would start using assessing for the reflexes. So for the Babinski reflex, I would stroke the lateral surface of the sole in an inward motion, and it should result in hyperextension and flexing of the toes. The next thing I would assess for is the stepping reflex. So I would hold the infant upright and let his feet touch the ground, and he should step up and down. The next thing I would do would be to assess for the Moro reflex. So I would hold the baby in a semi-sitting position and let the head drop back slowly. This should result in symmetrical abduction and extension of the arms and legs. And the neonate should make a C shape with a thumb and an index finger. The next thing I would do would be the rooting reflex, so I would brush the side of the cheek where the corner of the mouth is, and the baby should turn in the direction and open its mouth. The next thing I would do would be the sucking reflex, so I would put a gloved finger into the neonate's mouth and it should start sucking it. The other reflex I would do would be the palmar reflex, so I would press the finger in the neonate's hand, and the neonate should grasp fingers tightly. The next thing I would assess for is the plantar reflex, so I will place my thumb against the ball of the foot, and the toes should flex tightly down in a grasping motion. The last thing I would assess for is the tonic neck reflex, so I would place the baby in a supine position, turn the head to the side so that the chin is over the shoulder, and the neonate should assume a fencing position with the arms and legs extended in the direction that the head was turned. And that's all.